Hi folks, Ron Ray here with Turning 65 Solutions. I just wanted to tell you a story about a person I had come into my office a little while ago, and I turned them away. I told them they did not need to buy insurance from me or anybody else. And it's an example of what I do from day to day is just take your specific situation and give you advice on it. And sometimes that advice is don't buy anything from me. So the lady came in and she's on a insurance plan from her husband's former employer. He's retired and has insurance from his employer. He's about 71 and she's 64. She's going to be turning 65 in a couple of months. And they've been looking at Medicare supplements versus the employer's plan. Now with the employer's plan, her share of the premium cost them just a little bit over $300 a month, plus what they would need to pay for Medicare Part B. Their plan does require them to have Medicare Part B, and then the company's insurance plan would be their supplement, working as a secondary, and then they would have zero out-of-pocket cost. However, as a supplement, that's pretty expensive, especially in our area, a little over $300 a month. Now, it does include prescription drugs, and the prescription drug plan is okay. It's not bad at all. It's pretty good. So what we did was we took that and we compared it with a Medicare supplement that they could get from me from a private company, such as something like Mutual of Omaha or Aetna or Cigna or United Healthcare, AARP, some company like that for a Plan G Medicare supplement. And we came up with a price for her of about $105 or so. And then her total out-of-pocket cost for the year would be about $185 in this year, 2019. That would be the Part B deductible. And so that would save her about $200 a month on premiums for the same or even better coverage. And certainly better access, because her employer plan, though it works as a secondary, it does have a network, and if they go out of the network, then the secondary plan doesn't cover quite as much, so they would have some more out-of-pocket cost. So we're looking at the same or better coverage for $200 less money per month. So that sounds like a good deal. But then we get into her prescription drugs. She's got a few health problems and that are chronic problems that she's always going to have. And we look at her drug list, and I put those drugs that she takes into the Medicare system. You can do it using this yourself, medicare.gov, and follow the links to find a drug plan. And we put those in, and that showed me that for what she would pay for her prescriptions on her husband's employer's retirement plan versus what she would pay for prescriptions on a Medicare Part D prescription drug plan would be about $200 a year more in copays at the pharmacy. The Medicare prescription drug plan would cost her about $200 a month more than the employer plan. So that wipes out the $200 savings on the supplement premium. In other words, it's a wash. It's about the same price for about the same coverage. But that's with her current prescriptions only. So what that does is that leaves her open to a pretty large risk when it comes to the prescription drug coverage. If she were to pick up a new prescription that was very expensive, or if she was to become subject to the donut hole in the prescription drug coverage, that could potentially cost her thousands of dollars a year more than if she had stayed on her husband's retirement plan. So what I told him is just that. The savings is a wash. There's no savings, and you're putting yourself at a little bit greater risk with this plan from one of my private companies. So what they needed to do was stay with the retirement plan, and if things changed, the plan went up or the plan changed, then they're going to call me and we'll go through this whole exercise again. So that's just one reason why you may not want to drop your employer coverage and go with a supplement. And I tell people that often, more than once a week probably, for all the people that I see. And that's part of the honest, objective opinions that we give you, and they're based on the information that we gather from your source of insurance versus the insurance that we offer. And we simply just put them side by side on paper. We'll let the math speak for itself, and you pick the one that you think makes the most sense to you. So that's all I have for you today, folks. I appreciate you listening. If you find this information valuable, well, click the like button down below, click that little thumbs up, and subscribe to the channel. Hit the little red box that says subscribe, and then the little bell icon right beside it, so you can be notified of when we release new videos with more helpful information. Be sure to like and comment. Give us a call if you need anything, if you have any questions. If you're in a similar situation and you're not sure what to do, give us a call. The number's 830-217-6711. Again, my name's Ron with Turning 65 Solutions. Thanks for listening, folks.